And welcome back. In a city where the fight for safe and stable housing is increasingly urgent, a new report titled A Crisis Compounded, the dual crises of domestic violence and homelessness. It exposes the harsh realities faced by survivors of domestic violence seeking affordable housing. Now, the findings reveal domestic violence is a leading cause of family homelessness, even surpassing evictions. Joining me now and sharing more is the Director of Policy and Communications at New Destiny Housing, Gabriela Requena, and we thank you so much for being with us.
Thank you so much for having me, Darren.
Two words when we talk about domestic violence and homelessness. Doesn't seem like they go together, but the fact is they do.
Absolutely. And that is exactly the purpose of our recent report, A Crisis Compounded. We wanted to document and showcase the barriers and the hurdles that countless of domestic violence survivors face in New York City and really across the state. If you think about it, if you're in a situation of abuse and perhaps you don't have the social network, you do not have that cousin or that friend or that relative that can put you up in their couch or host you for a little bit while you're escaping a situation of abuse, chances are is that your only choice other than staying with your perpetrator is going to be to enter the shelter system. New York City has the largest shelter system for domestic violence survivors in the country, and it is constantly at capacity. So people trying to get in the shelter to try to make things work for them and their children. But also, we've seen that the Department of Homeless Services shelter system, that's the bigger system in the city, that one also has a large number of, especially families with children who are entering that system because of domestic violence.
And what the intersection of domestic violence and homelessness, it crosses in so many, in so many households. How prevalent are we seeing this?
So domestic violence doesn't discriminate. It can really happen to anyone who is in a in a relationship. It could happen also between. It's not always a partner, an intimate partner dynamic, right? Power and control can be exerted from a child to their parents or their parents towards the children. But we see it happen across all demographics, all layers of the population. But what we do see is that families of individuals of color, especially those who are female, especially those who are Black or identify as Hispanic, those are the ones that make up the majority of the population in the domestic violence shelter system. In 2022, 97% of heads of households in the domestic violence shelter system identified as women, and about 93% identified as either Black or Hispanic.
And as we look at those numbers are, uh, pretty much, what we've heard recently. And I want to talk about what we're hearing because when we hear about these numbers, we hear about the effects, and the effects are not just with these, but this also goes down to children. And I want to take the moment just to really break down a little bit about children when it comes to being children in domestic violence shelters. We're seeing more and more children now occupy domestic violence shelters. Correct me if I'm wrong, but these are more children than we've ever seen before.
Yes, there has been an upward trend in terms of population. The largest age group in domestic violence shelter is, in fact, individuals who are under the age of 18, so children. And the largest group within the broader category are kids who are under the age of 5. And something that I just want to make note of something that you said, Darren, that's about the intergenerational component and aspect of both homelessness and abuse, which is something that we focus on the report, is that children who experience or witness abuse in their home are more likely to either be victims or perpetrators as adults. We see that if a son witnesses her mother being abused by their father, they're 10 times more likely to be abusers when they grow up. Similarly, if a daughter, a girl witnesses violence or is victim of violence in their household, she is 6 times more likely to endure sexual violence when she reaches adulthood. And not only that, but also the homelessness aspect is very much intergenerational. In the largest shelter system in the city, the Department of Homeless Services shelter system, we've seen that 1 in 6 heads of households were in the shelter system themselves when they were children. So, early intervention systems of support, housing especially, are really essential to break the cycle of homelessness and to give kids and parents a chance to thrive, to achieve their dreams, and to break the cycle for good.
Yeah. Gabriela, I do want to have the opportunity to talk a little bit about this report and the survey because in this report and survey, there is some recommendations that are made towards the city and to those who are in the state. And I want to break that down for a moment. You take a moment and unpack that.
Absolutely. So we make 13 recommendations for both the city and the state in our report, and those are within four overarching areas. We really focus on the solution of permanent housing. That is the bread and butter of New Destiny Housing. In those four areas, we focus on expanding out access to housing resources and services in the sense of also making them available to individuals who are usually left out from the resources. You may know that a shelter stay is often required to get some type of rental assistance in New York City. Additionally, if you're an undocumented survivor, there are really very few resources that you can access. So in that category, we really focus on expanding those type of assistance, especially rental assistance programs for all survivors, not just those that have spent some time in the shelter system or those who have, a full household where everyone is a U.S. citizen. The second recommendation or overarching category of recommendations has to do with supportive housing. Supportive housing is permanent, affordable housing that is affordable. So individuals pay 30% of their income in rent, and they have on-site services for them. And we've seen that model. Originally, it started as a model that was more geared towards individuals who have chronic conditions, substance abuse issues, or severe mental illness. And since it has evolved to incorporate other populations that are just as vulnerable, including domestic violence survivors. So the city has a program that is that builds and supports funding for this type of housing model, NYC 1515, as does the state. The difference has been that in the city, the eligibility criteria excluded most survivors who wanted to try, who really needed this type of housing because they had to have a diagnosis, and they also had to spend at least a year in the shelter system. So that category in our recommendations is about expanding access to this really valuable and cost-effective housing model for domestic violence survivors. Our third category of recommendations has to do with flexible funding or direct cash transfers or assistance for domestic violence survivors. The city, both the city and the state, over the last year have done made tremendous strides to make resources like financial assistance available to domestic violence survivors. Our recommendations for those programs is to increase the funding. Both the city and the state, as I said, have programs, but they're not funded at the right level to meet the need. So we focus in that category to increase, the amount of money that's available to New Yorkers in the city as well as the state. And number four is improving data collection and reporting because simply you cannot address a problem that you're not counting, you're not documenting correctly. So that in that one, we call for the city and the state to improve their methodology of how they capture applications for the shelter system, especially in the city, as well as the exits. We want to know when people are leaving the domestic violence shelter system, where are they going? We know because of research and data that it takes several tries usually for domestic violence survivors to leave a relationship of abuse. They may enter the shelter system once and then return to their abuser who promises that they will not do, anything back to them again. Um, so they leave the shelter to return to them, but chances are that the situation of abuse will likely worsen and they're going to end up back in the shelter system. So, really understanding where survivors are going after they leave the shelter system is important so that we can center on the solutions and get and assess, right, what are the interventions that are working, what is it that the city and the state and the federal government really should also increase investments on.
Uh, that transitional aspect of getting into housing is really critical, and we know that that can be a game changer that can set somebody forward or really set them back. As you assess the transitional housing situation, how do you see it from your lens?
Well, we see the city and the state have both taken major strides over the last few years to assist survivors. We see that the rental assistance programs for both city and state increased the voucher amount. But one thing that happens to most of survivors is that they also endure what's known as financial abuse. And that could be a range of things. That could be that their perpetrator is using their social security number to open credit cards or taking out loans without their consent. Or perhaps if they're working, the abuser is taking complete control of their income and they really never have a say as to how their money, their earnings are utilized. And so this financial abuse has severe, long lasting consequences for survivors where they some of them in some severe cases they have to relearn, right, they have to know how to manage a bank account, they have to work on improving their credit score and in other areas. And so having a support system that we see at a New Destiny, twofold. We see the need to provide housing navigation assistance, that is assistance in searching an apartment that is affordable or that falls in within the level of affordability that the rental assistance program allows. And then with that, also offering voluntary supportive services that are individualized and that cater to the needs of the survivors, that can help them address that financial abuse, that can help them address the trauma. There is a huge correlation between negative health outcomes and domestic violence. And most of the time, some of that goes undiagnosed. For instance, survivors can endure traumatic brain injury more often than football players, but they often go undiagnosed and therefore untreated. So making sure that survivors have those tools and resources to get diagnosed, to seek services, so that they can regain power and control of their lives and thrive is really important. And as I said before, we see it as this twofold approach, that is with the housing navigation component as well as access to aftercare services or case management that is voluntary.
Yeah. Uh, I'm thinking my last week was a conversation I had. I had to go back and remember what week it was. But last week I was having a conversation about uh, the process of the shelters being overloaded and the process that we're understanding that you know we can't take anymore. And I had somebody from homeless services with me last week, and the conversation really stemmed around the fact that the numbers are increasing, capacity is diminishing, and we are getting to a breaking point. Agree?
Absolutely. And I think that part of the problem, right, is the lack of affordable housing in New York City. And that affects not just domestic violence survivors, but really anyone that lives in the city who's looking for a safe home, right, that they can afford. And that is one of the key issues. If you're not increasing the outflow of shelter, right, people are staying in the shelter system for longer and longer, then obviously it's going to become a little bit, more difficult to accommodate those who are seeking shelter, who are escaping situations of abuse and that need that support. And I really want to highlight one of the key areas, well, one of the key findings of our report is that our domestic violence shelter system in New York City was really designed decades ago to cater to families with children. And what we've seen is that single survivors who are often members of the LGBTQI plus community, or who may be survivors of sexual abuse, human trafficking, or seniors, they are left out of the domestic violence shelter system because of just the way that the system has been built. That obviously needs to be revised. That is also one of the recommendations we make in our report. And so if and it has really, that has deep consequences, because if a survivor and a single survivor is not able to access shelter, then they're not going to be able to access rental assistance, right? So they may have to spend more times, if they're lucky enough to have a relative or some sort of social support that can accommodate them when they're trying to get into the shelter system, then they're not going to be able to access rental assistance or supportive housing, or many of the other resources that are available to individuals that are able to make it into the shelter system. So in the report, we talk a lot about mothers, we talk a lot about children, but I just wanted to make that note that it's also single adult survivors who are often the worst off without access to some of these very important resources.
For people who want to find out more information about the survey and tap in, how do they go about doing that?
Yeah, so the report is available on our website. That's newdestinyhousing.org, O-R-G. And for individuals who are looking for support, right, there may be some listening in to the show. I just wanted to flag that the city does have a 24-hour hotline. That's 1-800-621-4673, where they can call and get a better understanding of services, go through a safety planning procedure, and all of that. And also, a very important resource is the Family Justice Centers. These are hubs of services that are specially designed for domestic violence survivors who are, at any point of their housing or healing journey. There is one Family Justice Center in every borough, and folks can find location and phone numbers by reaching out to 311, or just doing a quick Google search online.
Yeah. Gabriela, it's been great having you. It's a topic of conversation we continue to follow here on the Social Justice Forum, and we definitely have to have you back as a voice. And I much appreciate your input and giving us the much needed tools.
Thank you so much, Darren.
All righty. We are taking a quick break, but guess what? We'll be back with more coming up right after this here on the Social Justice Forum.